Welcome, dear friends, to yet another episode of Paediatric Puzzles. This one's entitled Tiny Troubles, the Curious Case of Inguinal Hernias. I am Dr. Vivek Vishwanathan, your friendly pediatric urologist, and today we'll try and unravel the mystery of inguinal hernias. Picture this, your little one is playing tag in the park and suddenly there's a bulge in the groin. Or you are bathing your little one and you feel a lump in a spot where it's not supposed to be. Well, my dear parents, fear not, we've got this. Now the first and foremost question that crosses your mind is, what exactly is an inguinal hernia and why as a parent should I be really concerned? Well, think of it like this. An inguinal hernia is like a tiny wanderer. It sneaks through a weak spot in the abdominal wall of your baby and it sets up camp in the groin. Think of it as a mischievous tenant. But what signs should we watch for, you might ask? Well, I'll tell you. Firstly, the telltale bulge. Dear parents, keep your detective hats on. The bulge is like a mini mountain popping up near the groin. It can be on one side or both sides. Peekaboo! Pain or discomfort? Well, your little one might wince during playtime. Not something we really want, but yes, that's one of the important symptoms to watch out for. They might even cry during bowel movement. It's just the hernia's way of saying, hey, I'm here. The bulge might be there for a bit when the child strains or cries and might disappear when the child is calm or lies down. Well, that tells you that this is not a complicated hernia yet. Did you get it? Well, correct. But then you might ask, what exactly is a complicated hernia? Well, if the pain just refuses to go away, the bulge, which has been playing peekaboo for a while, is static. Your child suddenly stops pooping or he resorts to uncontrolled vomiting. Well, you just need to grab your horses and rush to the nearest pediatric urologist. How do we as pediatric urologists confirm that it's an inguinal hernia? Well, as always, we do a physical examination. We gently feel the bulge, look at whether it's reducible or not, and a host of other signs and symptoms which we are trained to look for. And lastly, as always, an ultrasound exam can help us confirm the diagnosis. What then, you might ask? Well, we have to get into action now, don't we? Surgical solutions. If it's a bilateral hernia in a child, we can always resort to laparoscopic repair. We make tiny incisions and fix up the hernia like a pro. Unlike in adults, there is no mesh or any reinforcement needed. This is not muscles that are weak in a child, it's just a defect that needs to be closed. Or we can always resort to open surgery, which is the classic approach, and stitch up the weak spot. These incisions are very minuscule. They go underneath the panty line and actually become invisible virtually once the child grows up. In archaic times, there was something that was called a hernia belt, more like a superhero belt for the abdomen, but that actually serves no purpose and is not resorted to these days. Are there any natural remedies? Well, no. You might try pushing it back, but actually it's not a game of hide and seek and it's highly unreliable and not recommended. There aren't any magic herbs and well, you really can't avoid surgery. In surgical books it's written, a hernia as soon as it's diagnosed should ideally be operated upon. There you have it, folks. Remember, inguinal hernia, like curious guests, might turn up at our door unwanted. It is upon us to show them the exit door. Consult your friendly pediatric urologist and let's keep those little wanderers in check. Thanks for tuning in to Pediatric Puzzles. Until next time, stay curious, stay tuned in for the next segment on umbilical hernia. And do like, share and subscribe if you found this useful. Peace out.